Greetings everyone. Welcome back to a conversation that I'm going to be having tonight with Dr. Wes Youngberg, and I'm going to we'll turn to him in just a moment. But one of the things that we have been thinking about here in our Fallbrook, California community is the whole COVID-19 experience. And the last time that we did one of these presentations was almost 7 months ago. And Dr. Youngberg, you're the founder of the Youngberg Lifestyle Medical Clinic here in Temecula, California. You are treating COVID patients. You have been walking through this whole process partially from your background in public health and the whole idea of epidemics, but also in the practical aspects of how it relates to the real world and people. And it's time for us to do an update. Just talk about what's happening now.
That's right. In fact, when we did the first updates here, Dan, we were very concerned because of the mathematic modeling that had been done at various institutions, Los Alamos Laboratory, the various schools of public health, and epidemiologists were coming out with some pretty startling predictions or projections at what might happen.
Well, startling and stark.
That's right, and so I was maybe foremost among some, and in taking that information and making sure that the public was aware of how serious this could be, and of course, very quickly we got into a situation where things were getting out of control. The concern was that the hospitals, because of the novelty of this, the unknown factor of what was going to happen once they got to the hospital, what was going to work and what didn't work, and so the concern was that the hospitals would be overrun and overwhelmed, and that even just normal people requiring normal care, having nothing to do with COVID-19, would not be able to get medical care, that it would create a huge problem, a burden on the healthcare system.
There was a fear factor, a big
Huge
fear factor, not only here but in the world.
And that's what led the politicians to take that information and say, we have to flatten the curve, and so we're gonna lock down for a couple of weeks until we kind of figure out what's going on. Well, unfortunately, some 7-8 months later, we've learned a lot, but the politicians are still treating this like we don't know anything. We're waiting for that vaccine, which may or may not be at least a partial answer to this problem.
And one thing, Dr. Youngberg, I want to make sure that anybody that's viewing this understands. We're not coming at this from a political perspective. Our interest is specifically in the health and well-being of ourselves, our families, and our brothers and sisters, wherever they may be, who are maybe watching this.
That's right. I get texts and phone calls and emails every day from patients I work with or family members that I work with that are saying, hey, my mother's got COVID, what do I do? Or I have COVID, what's the first thing that I should be doing here? So we're going to try to keep this real practical to give a perspective of how we should be looking at this from a medical scenario and what we can do at home. Because one of the key issues here that we'll get into is understanding that there are phases to this illness, and we need to understand how these phases impact our risk and what we should be doing.
So Dr. Youngberg, if we're thinking in terms of phases, that comes because we've learned a lot. And the phases are a key part. So what have we learned? Let's start with the phases. But we've learned a lot in the last 8-9 months.
Absolutely. The hospitals and the critical care units have become much more proficient at knowing what to do and when to do it. And a lot of this has to do with a recognition of the fact that the first week or more of the illness is the viral reproduction phase, where the virus is just cranking out, and we're gradually becoming more and more inundated by this virus to the point that it's got you. And so and the second phase is an inflammatory phase where the virus is really not involved anymore. So So there's been studies out there looking at antiviral medications. Some of them look very promising, very effective, and other studies didn't really seem to help that much. And that's because if you give an antiviral medicine at phase 2, where it's no longer a viral problem, it's an inflammatory problem, then you're not going to expect to see benefit. You have to treat the viral side of this early on, or else you're not going to get that benefit. Likewise with the anti-inflammatories, dexamethasone and other anti-inflammatory scenarios. If you do that early on in the condition, there's a potential that you could actually depress the immune system further, which is already depressed, and prevent the body's ability to fight this properly. Whereas if you give it in the second phase of the infection, typically at the time where you need to be in the hospital because you're having significant symptoms, then during that inflammatory phase, using those anti-inflammatory strategies are going to be very, very helpful. So that's the first thing that we learned, is that there's timing is very critical to this process.
Phases, I can see that, and I didn't understand that really until about 2 weeks ago. And one of the reasons why is because I've had some family members in another state that actually have contracted COVID. I mean, this becomes personal, and I have friends in the Midwest that have contracted it, and almost all of them, in fact, there's about 9 or 10 different individuals that I know that have contracted this. Only one of my family members, who is a male, has actually struggled, and he struggled in the phase 2. I didn't understand what was happening there, but now I do. I understand that that phase is important, and I think it's important for our viewers to understand that there's a phase to this, and you want to make sure you do the right treatments at the right time from this perspective. Let's make it even a little bit more personal, apply it to ourselves. People look at this differently. Okay, some people don't care. They don't wear a mask. They go see wherever they want to see, whoever they want to see. They want to eat out, whatever. And if they get it, no big deal. Other people are masked up and have shields on. They've done everything possible not to get it. And then you have that middle ground. That's probably the two ends of the bell curve. Then the middle ground that are doing kind of the best they can, but functioning along this way. And people today this is November the 18th, 2020. 2020 will always be remembered as the year of COVID. In fact, I was thinking Time Magazine should make COVID the man of the year this year. Okay, that's been the big thing. I mean, it's had a huge impact on our world and on our nation and our lives. But personally, okay, people that you know, or if you start, okay, what if you get this? And so I'm thinking in terms of the person that's saying, okay, we've come this far, I've avoided it, or maybe I got it and I don't want to get it again. But the phases is important. So I guess we go back and say, we don't want to be complacent. What can you do? Because one of the situations with my family member, Dr. Youngberg, was he was in the second phase. First phase, he was very sick with a intestinal GI problem. They tested toward the end of that week, and yes, he had it. And then he went into the respiratory. And by the time it looked like he might need to go to the hospital, guess what? Hospitals were all full where they were. And so they had to work at home. And I think that that's the thing people need to be thinking about. What happens? How do I deal with this? Because we don't want to be complacent. We don't want to be overdone. We want to be smart in how we approach it.
We need to know what to do at home. Because as you just pointed out, Dan, many individuals, especially in this second wave, some call it, other people call it just an extension of the first wave, because we flattened the curve so much initially that the curve is still, that first wave is still going, right? So flattening the curve really was about giving the hospitals time to figure out what to do, and therefore hopefully decrease death rates, because the hospital was doing the right thing for people who were seriously sick. But that flattening the curve had nothing to do with decreasing the total number of people infected. Eventually, you're still going to have just as many people infected unless you have a cure. And we should not expect a cure for this anytime soon. Okay, the vaccines, if they work, and there's some promising, evidence that they may indeed help, but there's really no proof at all that they're going to solve this problem. And many of the vaccine manufacturers are already saying well, we're still going to have to wear masks. We're still going to have to do other things because the vaccine in of itself isn't going to be enough to solve this problem.
And will it be a vaccine that's forever, or will it be like the other flu vaccines we have that you got to take every year? And we still, with all those vaccines,
and what we know about coronaviruses is that we have to basically re-immunize on a regular basis, and then even then, it's not a perfect science. We know that.
Yeah.
So what's really important to understand is that this virus is really so infective that it's going to impact everybody's life. It's going to reach you and I. It may have already reached you and I, but we were able to fight it off because of a strong immune system of what we've been promoting all along since February 2020. So the important thing is that we should be prudent. We should seek to decrease the dose of virus that we get exposed to as much as reasonable. I don't think we should. I'm not afraid of this virus personally. I am making sure that I'm making wise decisions about optimizing my immune system, because if we've learned anything, Dan, over the last 8 months, is that the most critical thing is to have a robust immune system. If you do the things that are necessary and effective for optimizing your immune system, you essentially have no worries with this virus. Okay, there's even if you have other genetic mutations that increase your susceptibility to the virus because your interferon response is, we know that in people who get seriously ill, the interferon response, there's a genetic mutation that impairs the ability of that to work, or the body's making antibodies against interferon, and so your immune system doesn't get turned on. But there's ways to bypass that. You can do the hydrotherapy, the contrast, hot, cold showers. That bypasses. You don't even need interferon to activate your immune system if you're doing some of these simple remedies that we've talked at length about in the past. So basically, don't sit back expecting the government to cure this with multiple vaccines, etc., because ultimately this virus is going to keep going. Okay, and what the only real difference is going to be how vulnerable I am or how hardy my immune system is to keep me healthy in the face of an exposure or an infection. Okay, so those are some of the things that we want to really highlight here. This is something that everybody can take advantage of. And for instance, we'll talk a little bit about this, is that we now know that vitamin D, there's not just theoretical basis for this like there was in February and March and April, but now there's been so many studies that have been published in various aspects of getting infected or requiring hospitalization, that vitamin D there's a tremendous amount of research showing that we need to optimize our vitamin D, and that powerfully alters both phases of the infection. It helps decrease the viral replication. It actually minimizes the ability of the spike protein of the SARS-CoV-2 virus to actually infect the cell, to attach and infect the cell.
We knew it was good, but it's really
good. And then the flip side of that is that it also dramatically is helpful in the second phase of the infection, when the virus is no longer that active. It's primarily now an inflammatory response. And we actually heard people saying back some 6-7 months ago, oh, that's why we probably should be using vitamin D or N-acetylcysteine or some of these natural nutrients that can help, that can actually turn up the immune system, because they're thinking during the second phase we don't want to turn up the immune system. We don't want to create that cytokine storm. And now we know that optimizing vitamin D during the sickest phase of phase 2, where people are really at risk of intensive care need, etc., dramatically decreases the risk of cytokine storm in a powerful way. And we can go over those studies in a bit.
Okay, we'll do that in a second, but I'm thinking of myself. I just did blood work not long ago, and I have been taking vitamin D as well as using iodine the iodine kind of
Spray.
spray, and vitamin C, taking the Young Immune, which is a combination of things that you've recommended. And I was looking at my lab results, and my vitamin D is like 66. That's a good level, isn't it?
Yeah, so let's actually talk about a study that one of my idols, if you will, Dr. Michael Hollick, he's a very enjoyable person to talk to and to listen to, really funny, interesting sense of humor. But he's a physician and a PhD researcher at Boston University, and he actually did a brilliant thing. He looked at the NHANES data. This is the U.S. government health census data, where they looked at 192,000 individuals, all of which had vitamin D levels tested in the last 12 months. So we knew, or they knew, the actual blood levels of their vitamin D. And all these individuals had also received a COVID-19 test. So they used that retrospective data to scientifically analyze what the relative risk was of somebody with different levels of vitamin D in their blood and actually getting infected or testing positive with COVID-19. And this was astounding. This was published recently. And they actually showed that if you had a vitamin D blood level that is defined as frankly deficient, that's really low, way below an optimal level at less than 20 nanograms per deciliter, that the rate of positive testing, of being actually infected with COVID-19 was 12.5% of that population. So if your vitamin D was low, under 20, 12.5% of those 192,000 individuals tested within that group tested positive. If their blood levels of vitamin D were just a little bit better, 30 to 34, which is at the very bottom of what we call the normal reference range. Normal reference range is between 30 nanograms per deciliter and 100. That's normal. And I've always said for the last 20 years, based on the research, that the upper third of that normal range is really where we want to be optimally. There's a lot of discussion about where that should be, but in my 20 years of experience of researching this, upper third of normal. So somewhere like between 70 and 100 would seem to be optimal. So
I'm right at the bottom of that.
You're just under that. But fear not, because you're actually, based on this study, in a very good position. So if your level was between 30 and 34, right there at the bottom end of that reference range, just into the acceptable range, your rate of testing positive for COVID went down to 8.1% from 12.5. So you're already dropping the risk of being infected there, based on that study, by over a third, about a third. So if, however, your vitamin D blood levels were 55 nanograms per deciliter or higher, which yours clearly are, Dan, then your risk dropped down to 5.9% of the time those people tested positive. So now that's a retrospective association study. That does not prove cause and effect, but it is a clear indication of stating to the medical community, hey, pay attention to this, especially with the hundreds of studies that have been done previous to COVID-19 showing how beneficial vitamin D is to lowering the risk of getting the common cold, of getting the flu, of getting all kinds of illnesses. So that was the first study that should give you,
that gives me courage.
Courage that you are in a much better position than literally about 90% of the public.
Now let's talk about vitamin D in one other aspect, Dr. Youngberg. What if I have been tested? Let's say somebody's watching this. They've been tested and they're positive. And they're in the middle of that first phase, which we talked about a moment ago, where the virus is still replicating and going, but they haven't got to the inflammatory phase yet. What would vitamin D do for that person at that moment?
Okay, so it's important to understand that the first phase, the biggest chunk of that first phase, is where you're either asymptomatic or pre-symptomatic. Asymptomatic means that you're never going to get the symptoms, right? Yeah. You just don't have, you have the virus, but you don't have the symptoms. And we know that about 80% of people who get infected with COVID-19 will be pretty much asymptomatic or maybe minimally pre-symptomatic. In other words, they don't have any symptoms for the first average of 5 days, but then they might have mild symptoms.
Sure.
Right? Where, there's not even a consideration of that individual required to hospital.
So 4 out of 5 people.
It's basically like a cold or a mild to moderate flu, and then it's over. Okay, so literally 4 out of 5, 80%, right now, no matter what they're doing, they're already pretty much no big deal.
Yeah.
Okay, so what we want to do, and this is something that Dr. Roger Schwelt in his Med-Cram series has been championing from the very beginning, actually, that what if we could, so that 20% of individuals that get COVID, that get sick enough to require hospital care, what if we could do something during that initial phase, okay, prior to having severe symptoms requiring hospitalization, that would increase it from 80 to 85%, 90, maybe 95%. So only 5% actually need the hospital. That would decrease the need for hospitalization by 75%,
wow,
solving the hospital crisis.
That would That would be incredible.
Okay, now I personally believe, Dan, that that's very possible to do. I personally believe that if everybody started taking advantage of these very simple strategies that are available to everybody, okay, that cutting down the hospitalization rates by over 75% is very obtainable, because hardly anybody is doing these things that we're talking about. Yeah. We know that 83% of individuals in the hospital that with COVID, with severe symptoms, have very low vitamin D levels. Why don't we solve that right away? And that's why here at our church, here at Fallbrook SDA Church, in the last 2 weeks, we've actually been handing out free bottles of liquid vitamin D3 and a handout, a single full-page handout that says, hey, these are the statistics, these are what the current studies are showing, and this is what you can do at all levels, right?
Yes, that's right.
If you've been exposed, what do you do? If you know you're infected and you have COVID, of course, if you got exposed and you got tested and you tested positive before any symptoms, that would be ideal, right?
Yeah.
So you're starting to do something right away. So that's why do we wait to try to improve our immune system until we're like coughing and hacking and feeling miserable, right? Let's not wait for that.
So let's just say that somebody hasn't been paying attention, even though vitamin D's been all over the news.
Right.
It's been everywhere because of these studies.
For the last 20 years, it's been all over.
And especially in the last 6 months.
Yes.
Okay. But let's say that your vitamin D level, and you have no idea what it is. Okay, you haven't tested it, but you assume it might be low because you haven't been outside in the sun.
If you're not taking vitamin D as a supplement,
it's low.
It's going to be low at least 95% of the time.
Okay, so
I know this because I've been checking every single patient that I see for the last 20 years. Every child, teenager, adult, elderly, everybody gets tested for vitamin D. By the way, if you go to your doctor and your doctor says, I don't think your insurance is going to cover it, then say, well, do you have a way for me to get a discounted rate to get this tested at LabCorp or Quest? And if they don't, okay, then go online and you can get a blood spot test. They can just figure out where you can get a home-based vitamin D testing kit where you just do a little finger stick like diabetics do all the time. It's no big deal. You put a drop of blood on this little little kit, and you mail it in, and within a week or two, you'll know your vitamin D level, and it's just as accurate as getting your blood done. And that's usually under $60. Don't risk a deadly disease because you want to save $60.
Absolutely.
Get yourself tested. That way, you're not going to be kidding yourself of, I get plenty of sunlight, Dan.
Yeah.
I go surfing almost every Friday. I get a lot of sunlight. But if I didn't take vitamin D, I guarantee you my level would be low. It's really, you can't rely on sunshine to optimize your vitamin D. I know this, Dan, because I used to work in Guam. near the equator, and I'd go walking in my bathing suit in the afternoon 3 or 4 times a week for an hour or two. And my vitamin D was low then. And that was 20 years ago when I could make more vitamin D. The older we are, the less likely you are to make vitamin D because, well, there's a lot of reasons for it. So in other words, don't listen to people who say, well, if you're just out in the sun 15 minutes 3 times a week, you should make all the vitamin D you could. Even if you're making it, you're not necessarily optimizing your blood vitamin D levels. And how do you know? Test it. To prove it to yourself that you need to supplement appropriately.
So, I'm thinking of several different ways to approach the vitamin D question, Dr. Youngberg. One, you ought to do like we've done, and I've done since I have known you for the last 10 or 12 years. We have been supplementing, Karen and I have in our family, and our vitamin D levels are up. Hers was even higher than mine. We've been carefully doing that. But let's say somebody hasn't done that, and they are now saying, hey, I really need to get this. How long does it take once you start taking a dose of vitamin D to get it to a level? And I guess, so I that 2 parts of the question. One, how long does it take? And then if I just found out I've got it, if I start taking it right now, will it help me?
It helps in every scenario. So
okay.
We know that there's studies showing that taking vitamin D lowers your risk of getting infected in the first place. If you have a low level of vitamin D, you're about double risk of getting infected. Okay?
Well, that's a good reason to take it right there.
About a 77% increase. Different studies show different things. If you have if you're infected and your vitamin D level is low, you're at much higher risk of actually requiring hospitalization. If you are hospitalized and you have a low vitamin D level, you have a much higher risk of requiring intensive care, critical care, support, which means now you're really serious. Okay, and if you are in critical care and your vitamin D levels are low and then you're not being supplemented appropriately, you're at much higher risk of dying from that event. So we have the data. I have the studies right in front of me to support that. And so here's the first step, Dan.
Okay.
Is to not wait until you get sick. So everybody should have a plan, a strategy to start building up the stores of vitamin D right now. Okay, and I had the privilege about 15 years ago. Dr. Eric McDrid, who's a family physician here in Temecula and Menifee, California, he was writing a book on vitamin D.
I remember that.
And so we were collaborating on this, and so we went to the very first international conference on using vitamin D in a medical practice. It was right here in San Diego, California, and the famous Dr. Michael Hollick, who did the study in Boston, he was there speaking, and Dr. Robert Heaney, who is the professor of medicine at Creighton University in Omaha, Nebraska, who's sat on the FDA Board of Nutrition, the only vitamin D researcher on the board, and the board would never approve his recommendations, even though he was literally one of the top 3 experts in the world. Okay, so there's kind of a backlash, kind of fighting vitamin D use for some odd reason.
For a number of years.
For ever since the beginning. And it's like, well, I won't go into that.
And now it's changing a little bit.
It's starting to change. Well, that's because other countries are doing research on this and publishing it, and the U.S. is going like, oh, I guess we better kind of get on board here, right? So the bottom line here is he's saying every child across the United States, really of the world, should be using 2,000 units of vitamin D a day. Now, that's far more than what the government committees suggest. I will grant you that, but you got to remember that committees, committees are political, okay, and committees make decisions based on looking at all different angles of this, and so what you end up getting from committees oftentimes is mediocrity. Everything gets kind of minimized, and so you end up getting a recommendation that is not as strong as it should be.
Well, it's the lowest common denominator.
Yeah, it's pretty much the lowest common denominator. So what I've done in my work, in my lifestyle medicine practice over the last 30 years, I will study what the committee said, but then I'll go to the top researchers. And if I can, at conferences, I'll go talk to them.
Sure.
And I'll ask them, what do you believe based on your 50 years of experience researching this? What do you do? And that is much more valuable than some rubber stamp committee that has many other things to consider besides what is best for you and I.
Okay, so kids 2,000.
Adults 4,000. Okay. Now I personally take 10,000. Dr. Fauci takes 6,000. That's been published by a researcher. I mean, an interviewer that asked him flat out, and he was honest about what he was doing. I just wish that he was just preaching this as a vitamin D evangelist, because if it's good for him,
yeah, it's good for everybody.
Everybody should be doing it, right? I mean, isn't he the Norman Rockwell of COVID research, right? And so anyway, so I take 10,000 a day because I've found that that's what I do best with when I test my vitamin D over and over again, every 6 months or so, and so that for my patients, which typically I'm dealing with patients who have underlying medical conditions. Diabetes, hypertension, heart disease, obesity, on and on. These are situations that dramatically increase risk. Okay, and as we get older and are more prone to these things because of a longer period of time of being exposed to the things that cause it, right? It's not really an age issue per se. Our innate immune system gets weaker, and it's the innate immune system that needs to be woken up, that needs to be brought up to activity again, that during that initial 5 to 7 days of the infection, it's not working. It's not acting like nothing's wrong. It's not trying to fight the virus.
Because
the
they're
virus
sneaking in.
has this interesting ability to kind of lull our immune system to sleep. And so that's why we need to be doing the healthy behaviors during that phase. A lot of us don't even know we're in that phase, and so that's why we need to be living healthfully, not eating sugar, doing the hot cold showers once a day to stimulate the immune system. And vitamin D is one of those things, Dan. Vitamin D activates the innate immune system, and it actually blocks it inhibits to a point the virus from infecting the cell.
Okay, so all right. So you're taking 10,000. I think I'm taking about 10,000. Other people may be taking Dr. Fauci 6,000, kids 2,000. There are certain situations where I know you have said that even a more massive dose would be appropriate. And I have two questions. Can you get too much vitamin D? And number two, if you are in a crisis situation, like you're starting to have the cytokine storm, is vitamin D going to help, and what kind of dosage would it be? And I'm, of course, looking at the University of Cordoba study right here.
Yeah, absolutely. So really my favorite study to date on the question of is vitamin D beneficial is a study that from University of Cordoba in Spain. And they did a randomized blinded study, double-blinded. They call it double-masked study, which means the researchers don't even know who's getting the vitamin D, and the doctors who are treating these people don't know who's getting the vitamin D and who's getting the placebo. Okay, and so they had 75 individuals who were admitted to the hospital in Cordoba because they were so sick with COVID they needed to be hospitalized. Now, everybody who got admitted got the standard of care. They got, all the bells and whistles, whatever was appropriate and accepted at that point in time, and this would have been in June, July, August. They got it. The only difference is that the treatment group got a bolus of vitamin D that was the equivalent to 65,000 units of vitamin D. They actually gave a metabolite of vitamin D called Calcifediol, which doesn't have to be activated by the liver. So it gives you about a 12 to 24 hour advantage.
Okay.
Now the reality is you don't need that. If you have the metabolite at the hospital, then use it.
Sure.
Okay. But really, just taking vitamin D is going to do almost as well. And And so it was roughly about a 65,000 unit equivalent.
All at once?
On day one.
Okay.
Yeah, on a bolus.
Okay.
Now, I've actually been doing this for the first symptom of a cold or flu for the last 20 years.
Okay.
Now, in fact, there's published editorials of the top experts on vitamin D around the world getting together, and they said at the first sign of a cold or a flu, and we could now say COVID,
yep.
That you can take up to 1,000 units of vitamin D per pound body weight per day for 3 days. Now
Okay.
you do the math. It was 2,000 per kilogram. So I'm just kind of making it easier for us Americans that aren't used to that.
Yeah, that's right.
Okay, so roughly 1,000 per pound body weight per day. So let's say I weigh 175, so I could theoretically take 175,000 units of vitamin D once a day for 3 days to treat a building more serious infection that I'm feeling.
It's kickstarting.
Let me qualify this, because even though that was the recommendation in the initial report, my experience is you don't need that much. Okay? My experience is that if you do 50,000, which would be roughly like a dropper full of the vitamin D liquid, if it's 2,000 per drop, 25 drops would be 50,000.
Sure.
So I could tell you experience after experience. Real quick, I'll tell one. My mother, who was in her early 80s at the time, we had traveled to Geneva, Switzerland, to participate and speak at a worldwide, international health conference for the Seventh-day Adventist Church. It was the very first one, and it was being held at Geneva because that's where the World Health Organization is, and we were collaborating with them. And I was doing a talk on diabetes, and
I remember that.
It took us 2 days to get to there because delays in planes, and so we were horribly sleep deprived by the time we got to our hotel room in Geneva. And my mother, bless her heart, she's a hard worker, and she said to me that night, says, I feel like the worst flu I've ever had is coming on. And when I feel this way, I am down and out for a week to 10 days. And we were just at the beginning of a 2-week tour of Europe where we're going to be speaking at different places along with that conference. And so we're going like, this can't happen. We put all our time and effort into this tour that we were going to take, speaking at churches and other organizations. So I happened, well, it didn't just happen. I learned my lesson.
Okay.
I had a bottle of liquid vitamin D on my carry-on, actually. And I said, Mom, I'm going to give you a dropper full. I'm going to give you 50,000 units of vitamin D. And she didn't argue with me a bit. She's a pretty stubborn lady. She has her own mind, but she was feeling it. And she said, okay, I know you're just my son, but I'm going to let you play doctor today. Okay? And so I just had her open her mouth, and I gave her 50,000 units of vitamin D. The next morning, we wake up and we're thinking, oh man, how many times am I going to have to do this, with the hope of her getting over this in 3 to 4 days? She was fine. Now, I know that's a
1 day.
That's an anecdote,
wow.
Right? That's not a study, but I expected something good to happen. Why? Because I read the research. Because I've practiced this now for 20 years, and it's one of the most powerful things I've ever seen. If you catch it early, like day one of symptoms, most of the time it's gone. It's gone within a day.
So the pure logic says
that
for COVID it's going to also be very helpful.
Very, very helpful. And so we know that, and we know the biologic mechanism. It's all worked out. Yeah. So when you take vitamin D, it actually unlocks. This is Dr. Robert Heaney saying. It unlocks the genetic information in the nucleus of the cell that has access to how to make a chemotherapeutic agent against that very virus that you just got exposed to. Wow. So the white blood cells basically present that virus, and there's this vitamin D receptor that gets activated, and vitamin D then stimulates the production of the most specific chemotherapeutic agent you could ever make in a laboratory that is designed to fight that virus or that cancer or that bacteria, and we call it cathelicidin. cathelicidin is the antimicrobial peptide that is used by the white blood cells to literally kill the virus. Okay, and we know that this is working based on this University of Cordoba study. So they gave this bolus of vitamin D, okay, on day 1, then again on day 3, half of that dose, and again at day 7, and then weekly as necessary. The results were just astounding and should be all that is needed for the public health community, like our community church here, decide we're going to give this to every single family. I think we've passed out over 80 bottles of vitamin D already, free. And really, every organization, in my opinion, should be doing this.
And it's not that
pass
big an
it out
expense.
free. It's not that expensive, okay? And pass out a handout on how to use it, okay? And so what they found in this study is that the risk of those hospitalized patients of going on to require intensive care unit support, critical care support, in the group that got the dummy, the placebo, the vitamin D pill had no vitamin D in it, okay, they went on to intensive care 50%. 50% of them now got worse, so bad that they needed ventilator support or some other type of critical care support. Of those, almost 8% died. And those who got the vitamin D, only 2% required intensive care. I mean, that's a 25-fold differential. In other words,
and
you're 25 times more likely to require intensive care if you don't get vitamin D on that first day of hospitalization. I just received an email today of somebody says, my husband just got hospitalized. Can you send a note to the hospital to make sure they keep giving him vitamin D? You know, and I'm thinking, why should I have to send a note? They should know this already.
Well,
what's the downside? There's absolutely no downside. So, and here's the last part of the study.
Okay.
Dan. You know what the risk was of death in the group that got the vitamin D?
That's what I wanted to get to.
Zero. Okay. Now, this was a randomized clinical study that was double-blinded, which is the pinnacle of research. And so if we're not paying attention to that, then we got a problem.
Well, I can only imagine that anybody watching this right now is saying, where can I get vitamin D? And vitamin
Anywhere.
D is on any pharmacy, any
right.
health food store. You can get this in
I was
tablet
talking
form.
to a patient, very wealthy patient in Florida just a few days ago who said, I tested positive for COVID. What do I do? And so I said, well, you know my protocol. And she says, yeah, but I just flew into Florida and I don't have anything. I go, well, okay, you need to make sure you take your stuff with you.
Yeah.
Okay, but she knew enough. She said, you know, I can go online and order it at CVS Pharmacy, and they'll deliver it within a couple hours. You don't even have to leave your home to get vitamin D. Just order it online, right? I mean,
wow.
This is not brain science.
Now that was
right?
CVS.com.
Well, you know, that's what she did. And,
or any pharmacy.
Really, any pharmacy that delivers, you know, and a lot of places are delivering now, right? Okay, and you can call somebody else to go get it too.
Now, last question on this topic, because our time is going to get away from us. Can you get too much vitamin D? And
All right, so, yeah, of course you can get too much vitamin D, but you're more likely to get too much water than vitamin D. So I actually wrote about this in my book, Hello Healthy. There's an interesting study, case study, of a gentleman who ended up at the ER. This is years ago. And he was feeling horrible. I mean, he was getting all stiff and rigid and it just had very fatigued. And the ER doctor was doing test after test after test. Couldn't figure out what it was. And so finally, you know, it got this supercomputer thing where you put in all the symptoms and then they give you a long list of things that you should check for. And way down on that list was vitamin D intoxication. So he said, hey, you know, I'm running out of options here.
Try it.
So the doctor checked his vitamin D level. And, you know, I just said we don't want low levels under 20. We want really optimal levels above 55, but not above 100, right?
Okay.
Now,
makes sense.
we know from Dr. Robert Heaney's studies that you don't really get toxic till you're above 200, above 250. You have to be taking at least 40,000 units a day for many months to even get into that range. And the treatment is, well, just stop doing that because you don't need that much. There's never been one person who died from it that I'm aware of, never in the medical literature. All kinds of people die from drinking too much water.
Yeah.
Nobody's ever died from taking too much vitamin D.
So it makes really good
sense. Do
sense.
not fear vitamin D. So this guy in the case study, the doctor found out that his vitamin D level was over 700.
Oh.
I mean, that's horrible. Anything taken to that extreme is going to be bad. If it had been water, he would have died, right?
So use common sense.
Yeah, and so you know how much vitamin D he was
information.
taking for almost a year? 1,200,000 units every day.
Oh my goodness!
Because he was using a vitamin formula that had been basically mixed up in somebody's garage and sold cheaply. Don't get stuff unless it's being produced by reputable companies, so you know exactly what you're getting in it. So let me just read something real quick. There's a study in Ireland, Dan.
Okay.
That was produced, that was done by Dr. Daniel McCartney. And they basically were recognizing that they needed to protect the vulnerable. They recognized that the people at greatest risk for COVID-19 sickness, hospitalization, and death were the elderly, because they're more likely to be sick with underlying conditions, and of course diabetics, individuals who are sickly for any reason, hypertension, heart disease, kidney failure, etc. And so they said we should be taking care of these people and addressing their vitamin D insufficiency, which is over really probably 90% of those, or at least 80% of those, are going to be extremely low on vitamin D. And so here's their final conclusion. They recognized that vitamin D decreased infectivity, the adhesion of the virus to the cells to cause replication. And I'm just going to read their conclusions. He says, vitamin D deficiency is common and may contribute to increased risk of respiratory infection, including COVID-19. We recommend that all older adults, hospitalized patients, nursing home residents, and other vulnerable groups, those with diabetes or compromised immune function, those with darker skin, so ethnicity plays in. The darker our skin, the more protection we have from ultraviolet ray, therefore we get less vitamin D during the summer months. So you're going to have a much lower vitamin D blood level than people who don't have darker skin. Especially if you were born and you grew up in Ethiopia, and then you end up working in the UK where their sun doesn't shine hardly at all, you're really at risk now. And the answer is supplement vitamin D, which we all need to do anyways.
So this is probably the very reason why we have seen the people of ethnic dark skin background have a higher rate of COVID and COVID death. Yeah,
the disproportionate risk is primarily biological, and it relates to your ability to store vitamin D during the summer months. And so let's fix that. Let's fix that.
It's a simple fix.
So 82% of blacks have serious vitamin D deficiency, 70% of Hispanics, and about half of white. We're all at risk, right? Some more than others. We should all fix this right now. I'm fixing this. I'm doing that for myself, for my family members, my kids, everybody. When we call them every week, are you taking your vitamin D?
Yeah.
We need to check on that. So let me read the rest of this. So those who are obese, smokers, healthcare workers, they should be urgently supplemented with vitamin D to enhance their resistance to COVID-19. And this advice be quickly extended to the general population also. Brilliant. Why does it take somebody in Ireland to state the obvious?
Yes.
Why is it that we don't have more institutions that are handling this out? And, I'm part of the problem. I've been concerned about this for a long time, but I didn't actually come out with a solution for it other than telling my patients. It says we need to be community activists.
Yes.
We need to get on the phone and tell people, get on your vitamin D, share this information with them. And so that's why as a church, we decided let's give it to everybody. And so be part of the solution.
And that's
get
why
this out
that's why we're doing this. One of the things that will come out of this is that now maybe you will watch this, maybe you will share it with someone else, and all of a sudden everybody's going to be saying, hey, I've heard a little bit about this. Now I know specifically. So just review. Kids, how many milligrams of vitamin D?
Well, we're going with international units.
I'm sorry,
would be
international
2,000 units.
And adults?
So an adult's at least 4,000 units. But you asked a question earlier, Dan, that we didn't get to.
All right.
That is, how long does it take?
Yes, that's right.
If you just started that dose for that to actually build up in your blood to get to an optimal level? And unfortunately, the answer is it could be 3-4 months. Okay, so in other words, if we're now in this skyrocketing wave of infection and hospitalizations as well.
It's true, it is.
And so it would make sense to up that higher. Okay, if you haven't been supplementing at all, you should probably be doing at least 10,000 units a day. And don't wait 2 months to figure out how you can get tested through your insurance. Those 2 months may be the last 2 months of your life.
For $60.
Okay, right. So it's $60. Let's get it done, right? And right now, I would say, even if you don't get tested, assume you're low, and for the rest of the winter, get at least 4,000 up to 10,000 daily. That's not going to be too much. That's never been shown to be toxic. Okay, and so you basically this is one of the. There's many other things that we should be paying attention to. We're going to be be having more talks about this, but I wanted to make sure that we get this message out that there's some things that are so simple that if we look back, I recently I've got a phone call from actually a president of a large healthcare system, and he says, I was just talking to a relative and found out that you stayed with them when you were speaking at a church in the Midwest about 7 years ago. I says, yeah, I remember that. A lovely couple. He says, well, I got bad news. He says, this couple, they were traveling through Colorado recently. Both of them got infected with COVID. And the wife survived, but the husband died. The wife had been more healthy, had been paid more attention to her diet and so forth. The husband, not so much, and succumbed. Okay? 100% preventable.
Sure.
100% preventable. The first thing I thought is, I wish I had been notified immediately upon the first symptom or the first indication that they were positive, and maybe I could have made a difference for that family. Right? And so, but this is something that each of you can be ambassadors about.
Right.
It doesn't take a doctor to figure this out. It's a simple thing to do.
Okay. There are many other things in the immune system. We've got about 10 or 12 minutes left today. And I want to just say to you that we're going to be doing this again in 2 weeks on December the 2nd at 7 p.m. Pacific time. We're going to be doing a live stream right here from the same spot. So mark that on your calendars, and we'll be starting to talk about more of these elements. But in the time we have left, I'm thinking of people that are little children and older. We kind of jumped over that point a minute ago. Little kids don't seem to be affected by COVID that much. Young adults under 30 don't seem to have near as. But the older you get, the more, 60 seems to be a year that's kind of a dividing line. Why is that?
So what's interesting about this virus in particular, it's not at all like the flu that gets kids, right, pretty bad, and the elderly as well. But this one doesn't really impact kids hardly at all. Okay, I mean it's just very, very rare. They would have to have some serious complication. Even somebody in their late 20s, very rare for them to die. Just this week, I read a study, an article actually about a young couple in their late 20s that had a beautiful little 4-year-old boy. The father got sick with COVID, died. Okay, and the mother then 2 months later got sick with COVID, and she died. And now their little boy, who's going to turn 5 years old next month, has no mom, no dad. Again, that's really sad to hear because, first of all, it's extremely rare for somebody that young to die from COVID. But I saw pictures of them, and they were significantly obese. Obesity is a big, big driver of infectivity and getting sick earlier, getting more sick, ending up in the hospital, and potentially dying. why is that? One big reason is we've known this for decades now, that when you carry excess fat weight, those fat cells full of fat, they suck up vitamin D from your blood and render it useless for your immune system.
It's stored.
Okay? They basically store it, and once it's stored, it's never going to help you. It's gone. And so that's one reason that obese individuals or overweight individuals are much more likely to be deficient in vitamin D, even if they're getting more vitamin D than the average person. And so that's why you don't just rely on, I'm taking 2,000 units of vitamin D, which is kind of a high recommended dose in many medical circles. And yet that's really not going to fix the problem for somebody who's obese or diabetic or hypertensive or heart disease. So that's why we want to check, but we want to up that for adults to at least 4,000. So they have a fighting chance to have reasonable vitamin D blood levels.
So is the vitamin D the key factor difference between the 60-year-old and the 25-year-old?
Well, we've been focusing tonight on vitamin D because we just want to hit this home. We want to once and for all make sure that people recognize this is really critical. It's a simple thing. There's many other things that are important as well, and I don't want to suggest that vitamin D is the cure-all and the panacea. It's not, but it's a big piece of immune optimization, and we want to make sure we're sleeping well. We make sure that we're avoiding sugar, that we're eating well, that we got the right attitude, that we're not, the fear factor isn't destroying our health. If you're constantly afraid, I don't want to go near that person because they might have COVID, that feeling, that sense of fear actually depresses your immune system. So it's like a self-fulfilling prophecy. So there's many things that we should be paying attention. That's why we're going to do this again in a couple weeks. And I've been busy. I think this is the fifth webinar I've done this week for different organizations. And so I said, if I'm doing it for them, I should at least do it for my own church.
Absolutely.
Right?
And we're delighted that we can do that. And in just a few minutes we have left tonight, I just want to highlight again that December the 2nd, 7 p.m. Pacific time, we're going to be streaming this again. You can find it exactly where you saw this one, whenever you see it. But we're going to be talking about the other factors of immune building. And I think we don't want to leave people thinking that vitamin D is the only immune builder.
There's a lot of things.
Vitamin C, there's NAC, there's quercetin. All these multitude of supplemental things that you get in food or we get supplemented with. Healthy attitude, proper diet, sleep, as you said, those are all very important parts of building immunity.
There's a protocol that actually wrote up back in April and updated in May that's still on my website. It's 18 pages of information that doesn't have the latest studies in it that we reviewed today, but it's still giving the same recommendations, right? How to do hydrotherapy, and that's on my website, dryoungberg.com. And you'll see the second blog on the homepage in the lower left-hand corner, a whole 18-page blog on how to optimize your immune system in the face of a respiratory illness.
Excellent. So you want to download that, and we're going to try to get some of this additional information we've been talking about tonight up on that website again, so you'll be able to download that. So be sure and go back and visit on a regular basis. And I just want to thank you, Dr. Youngberg, for being willing to do this for our Fallbrook Church and for all the friends of the Fallbrook Church all over the world that'll be watching this. And I'm confident that people that make common sense, sound decisions based on good research, science, and experience are going to be benefited dramatically in their physical well-being. And I can't help but think one of your favorite things that I've heard you say in the past is you are the chairman of the board of your own health. And that is appropriate in this situation. People need to take control of their own decisions, get all the best information they can, but they're the ones responsible.
And
I'm the one
if individuals do that, then like Dr. Roger Schwelt, the critical care COVID specialist who's done probably more on this topic than any other doctor in the world, literally, he has over 50 million hits on his website. He has been championing this concept. Let us start taking control and doing things at home within our own families, every family, such that we can change that 80-20 rule. Instead of just 80% of people surviving and doing pretty well with an infection, we can change that to 85, 90, 95%. And so now the hospitals will not be overrun. They can treat everybody else that has health concerns as well.
Yes.
Because we are responsibly taking advantage of this information now rather than when it's too late.
That's right. And so we'll be bringing a lot more information to you in our next broadcast. But I just want, we're in a church, and you may or may not be a part of a faith community, but I would like to close this with prayer, Dr. Youngberg, just praying for anybody
Absolutely.
who might be watching this. And then I want to make sure you're tuning in a couple of weeks. So if you just bow your heads with me right now as we pray. Lord, I just pray that the information that has been shared this evening, out of the heart and experience and research that Dr. Youngberg has been doing and is out of the regular clinical practice as he sees the action, I pray that somebody's, I'm using plural, will hear this and say, I can make those little simple changes, I can do that, and have it be a very positive experience in their own personal lives and their families. Thank you. In Jesus' name I pray. Amen.
Amen.
Again, I'm Dan Houghton, Dr. Wes Youngberg here at Fallbrook Seventh-day Adventist Church, and we'll be seeing you again in 2 weeks. God bless you.